Massage Therapy Exam Prep Mock Test and Study Guide, 25 Difficult Questions. Question 1. Which massage stroke involves rhythmic kneading and rolling of muscles? Effleurage, Petrie's sage, tapotement, friction. Petrie's sage involves kneading, rolling, and squeezing to reach deeper muscle layers. Question 2. In SOAP charting, what does the O stand for? Opinion, objective, outcome, observation only. Objective data includes measurable observations like ROM or posture. Question 3. Which muscle is the agonist during elbow flexion? Triceps, biceps brachii, deltoid, brachioradialis. The biceps brachii is the primary mover, agonist, for elbow flexion. Question 4. What is a contraindication? A reason to perform a massage. A condition where massage is harmful or should be avoided. A type of insurance. A massage technique. Contraindications are conditions that make a particular treatment inadvisable. Question 5. The long shaft of a bone is called the epiphysis, diaphysis, periosteum, endosteum. The diaphysis is the midsection or shaft of a long bone. Question 6. Which term refers to the therapist's emotional reaction to a client? Transference, countertransference, boundary crossing, empathy. Countertransference is when the therapist projects feelings onto the client. Question 7. Where should you massage a limb with a 3-day-old sprain? Directly on the injury, proximal to the injury, distal to the injury. Do not massage at all. Massaging proximal to a subacute injury helps clear edema and improve circulation. Question 8. The agonist is also known as the antagonist, synergist, prime mover, fixator. The agonist is the main muscle responsible for a specific movement. Question 9. Which Greek root means skin? Osteo, myo, derm, arthro. Derm means skin, example dermatology. Question 10. Massage has what effect on the immune system? Decreases lymphocyte production, improves lymphatic flow and T-cell transport, causes fever. No effect. Massage stimulates the lymphatic system and can improve immune response. Question 11. What is informed consent? The therapist telling the client what to do. The client agreeing to treatment after being told the risks/benefits. The client's insurance card. A medical referral. Informed consent ensures the client understands the process and agrees to it. Question 12. A dual relationship in ethics refers to two therapists working on one client, the therapist having a second professional or personal bond with the client, using two different modalities, working two jobs. Dual relationships, example therapist and friend, can complicate boundaries and ethics. Question 13. Which muscle is often associated with tennis elbow? Biceps, extensor carpi radialis brevis, flexor carpi ulnaris, triceps. Lateral epicondylides, tennis elbow, involves the wrist extensors. Question 14. The power of a massage stroke comes primarily from the therapist's shoulders, hands, wrists, core and legs. Using the core and legs for leverage, stacking joints, prevents therapist injury. Question 15. What is effleurage typically used for? Deep tissue release, warming up tissue and spreading oil, breaking up scar tissue, trigger point therapy. Effleurage consists of long, gliding strokes used at the start and end of a session. Question 16. A bursa is a type of muscle. Fluid-filled sac to reduce friction. Ligament. Nerve ending. Bursae are sacs found near joints that cushion movement. Question 17. Which structure connects bone to bone? Tendon, ligament, fascia, cartilage. Ligaments connect bone to bone, tendons connect muscle to bone. Question 18. Scope of practice defines the size of the massage room, the legal limits and range of services a professional can provide, how many clients a day can be seen, the cost of a massage. Scope of practice defines what a professional is legally allowed to do. Question 19. The antagonist to the hamstrings during knee flexion is the gastrocnemius, quadriceps, gluteus maximus, adductor magnus. The quadriceps extend the knee, making them the antagonist to the flexing hamstrings. Question 20. Hygiene standards require that a therapist washes their hands once a day, only after the session, before and after every client, only if they look dirty. Standard hygiene requires hand washing before and after every patient contact.